Regulatory, everybody talks about that as well. What types of reforms do you think would maybe work best for the industry and for the regulators moving forward?
I think first and foremost, there has to be regulation. We're taking care of the most vulnerable adults in our population. And so we realize that there has to be regulation. It's easy to beat up the regulators. But what frustrates us is the punitive nature of the regulations and the regulators. And it's really, anybody who's lived through a survey has experienced it, because they really, you at least feel that they come in with the agenda, and the agenda is to beat you up. So one of the things that I've been active with and gotten the opportunity to talk to American Healthcare Association and work on some initiatives with them is, how do we achieve more collaboration? And one of the areas that we've looked to, and we haven't been successful yet, but we're going to keep trying, is how do we change the system of CMPs so that they're not going into a fund, and they're not going into a fund that doesn't get used, as we've read about over the last year, where North Carolina has millions of dollars in a CMP fund that nobody could access. Washington has those issues. Idaho has those issues. So how do we take that money and make it more readily available, and especially to the facilities that they might have had a performance issue. They might have had something, is an anecdotal example. We took over a facility from a distressed operator that was on the brink of going into Chapter 11, which they ultimately did and liquidated. And it was a troubled facility. And it takes a while to turn around a troubled facility. And early on, we had a survey, and we got hit with a big CMP from the survey. And what we tried to do, and we weren't successful, what we're going to keep trying is get that money to turn back and get it put in for clinical education, for staffing, for CapEx that would benefit the residents, for programming that would benefit the residents. And to me, it's a no-brainer. That's where the money should be going. Right. So that collaboration, we understand they have a hard job, but we all serve a common stakeholder. So how do we adjust our postures so that we serve them best?